Symptoms and signs. Describing problems. The problems which a patient reports to the doctor are called symptoms. For example, pain or nausea. Signs are what the doctor finds, also known as findings. And examining the patient, for example, high blood pressure or a rapid pulse rate. Symptoms are also known as complaints. To report a patient's symptoms or complaints, doctors say, Mr. Farnsworth was admitted complaining of chest pain. In case notes, the abbreviation CO is used. CO chest pain. Presentation. Patients say they went to see the doctor. Doctors say the patient presented the symptom which causes a patient to visit a doctor or to present is called the presenting symptom. Presenting, complaining, or presentation. His presenting symptom or presenting complaining was chest pain. He presented to his GP with chest pain. The usual presentation is chest pain. Talking about symptoms. Symptoms: tiredness, lethargy, fatigue, lassitude. Meaning loss of energy. Patients say, I feel tired all the time. I feel completely worn out. Lately, I've been feeling completely exhausted at the end of the day. Symptom: malaise. Meaning general feeling of being unwell. Patients say, I feel unwell. I don't feel well. I've been feeling off color for 2 days. I haven't been feeling myself for a week. I've been out of sorts all day. Symptom: anorexia. Meaning loss of appetite. Patients say, my appetite is very poor. I've been off my food for days. Symptom: weight gain. Meaning increase in weight. Patients say, I've put on weight kilos in the last year. I've gained 5 kilos. Symptom: weight loss. decrease in weight. Patients say, I'm not eating any less than usual, but I've lost a lot of weight recently. Symptom: constipation, meaning hard, high, infrequent feces. Patients say, my motions are very hard. I've been quite constipated lately. I'm not very regular. Note: the verb feel is also used with other adjectives such as hot, cold, nervous, anxious, dizzy, weak. She said she felt dizzy. Full blood count. In the investigation of blood diseases, the simplest test is a full blood count, FBC. A full blood count measures the following in a sample of blood: the amount of hemoglobin, the number of the different cells, red blood cells, erythrocytes, white blood cells, leukocytes, and platelets, thrombocytes. The volume of the cells, the erythrocytes, sedimentation rate, ESR, a measurement of how quickly red blood cells fall to the bottom of a sample of blood. Anemia. Anemia is one of the commonest diseases of the blood. It may be due to bleeding, loss of blood, excessive destruction of red cells, low production, for example, because the diet is lacking or deficient in iron. A medical student has examined an elderly patient with a very low level of hemoglobin and is discussing the case with her professor. Professor, what's the most likely diagnosis in this case? Student, most probably carcinoma of the bowel with chronic blood loss. Professor, what's against that as diagnosis? Student, well, he hasn't had any change in his bowel habit or lost weight. Professor, what else would you include in the differential diagnosis of severe anemia in man of this age student. He might have leukemia of some sort or a plastic anemia, but that rare. It would be very unusual. Another cause is iron deficiency, but, but he, he seems to have an adequate diet. Professor, okay, now there's another cause of anemia which I think is more likely student chronic bleeding ulcer. Professor, yes, that's right. But what about pernicious anemia? Can you exclude that? Well, he's got none of the typical neurological symptoms like paresthesia. Pernicious anemia. Jordi Pons, the medical student from Barcelona, has made some language notes in his textbook. Pernicious anemia (PA) is a condition in which there is atrophy of the gastric mucosa with consequent failure of intrinsic factor production and vitamin B12 malabsorption. The onset is insidious with progressively increasing symptoms of anemia. Patients are sometimes said to have a lemon yellow color owing to a combination of pallor and mild jaundice caused by excessive breakdown of hemoglobin because of ineffective red cell production in the bone marrow. A red sore tongue, glossitis, is sometimes present. Patients present with symmetrical paresthesia in the fingers and toes. Early loss of vibration sense and progressive weakness and ataxia. The spleen may be palpable. Onset beginning insidious, slowly developing, pallor, lack of color, mild, slight jaundice, bilirubinemia, breakdown, division into smaller parts, bone marrow, soft tissues in the cavity of bone, of bones symmetrical, each side the same. Vibration sense, ability to feel vibrations, progressive, continuing to develop, palpable, can be felt with the hand. Bones. Bones. Some common English names for bones. English name and anatomical name. Skull, cranium, jawbone, mandible, spine, vertebral column, breastbone, sternum, rib, costa, collarbone, clavicle, shoulder blade, scapula, thigh bone, femur, kneecap, patella, shin bone, tibia. Fractures. A fracture is a break in a bone. Some of the different types of fracture. Green stick, displaced, comminuted, impacted, open, or compound. A pathological fracture is a fracture in a diseased bone. A fatigue or stress fracture is due to repeated minor trauma. For example, long distance marching or running. Treatment of fractures. When the fragments of a broken bone heal and join together, they unite. Union may be promoted or helped by reducing the fracture, replacing the fragments in their anatomical position if they are displaced. After reduction, excessive movement of the broken bone is prevented by fixation, either external, for example, a splint, or plaster of Paris cast, or internal, for example, a pin or a plate and screws. A displaced fracture, which is not reduced, may result in malunion, incomplete or incorrect union, plaster cast, a pen, a plate, and screws. Screws. Note: the verb reduce has several meanings in medicine. To make smaller, I think we'd better reduce the dose of your tablets. In surgery, to return to anatomical position, a hernia can normally be reduced by manipulation. In chemistry, to remove oxygen or add hydrogen, nitric is a reducing agent.